Hi, I'm Michael Douglas, one of the physicians here at Western Wisconsin Health, one of the primary care physicians as well. And I've been asked to give a few words about my thought on how patients have dealt with COVID and how we as providers continue to set the example for our patients in prioritizing their health during this pandemic. Ever since the pandemic basically just blew up almost 11 months ago, patients here have, I think, benefited for three reasons. Because of the dedication, the sacrifice, and the commitment of the healthcare providers at this facility to make sure our patients have remained safe throughout this entire pandemic. And it sounds like adjectives to describe going into war, and for a lot of healthcare organizations, that's the way it was and still is. I don't work as a critical care physician. I don't work as a hospitalist. I work in an outpatient situation. But the overall work ethic is the same, especially during this pandemic. At Western Wisconsin Health, I've always been proud about how our coworkers here, my coworkers, have essentially set the example for our patients in terms of wearing PPE when we did, as we figured out exactly how to be safe around each other and around patients as this pandemic continued to unfold in the late spring and early summer of last year. And that is the dedication of the staff on a broad scale. And I think patients really do see that as they continued to come and felt comfortable about coming to this facility, even in the throes of a deadly pandemic like this, even when telehealth was an option, which I think we did our best to embrace here. But the fact that I think we continued to set the example in controlling the spread of disease among co-workers at this facility, patients pick up on that, and they essentially just kind of ran with it, and I think they have benefited from our staff's dedication. Sacrifice, same thing. It means different things to different people. For me, it's basically going home, taking off all my clothes in a spa that we have right next to the house, going right up to take a shower every night after I work here, and putting on brand new clothes. And those things that are now, I guess, are somewhat of a normal occurrence as we continue to make sure that our families are safe after coming to work at a healthcare facility like this. And the sacrifices that healthcare providers have made during this pandemic to ensure the safety of their families and friends they live with, again, is just unparalleled. And I think many of the healthcare workers at this facility have again risen to the occasion and sacrificed to keep those people safe. And finally, commitment. You can't have commitment without dedication. And we at West Wisconsin Health are still, as we always will be at the facility, dedicated to the best healthcare for the patients who come here. And that takes all forms. It takes treatment of disease. It takes prevention of disease. And again, this is where we set the examples by not only decreasing the spread among staff by taking these measures, but also by getting vaccinated. We've just started vaccination series for the general public, falling in certain age groups at this facility, and it's gone really well. The vast majority of patients have had good experiences, and it all fits in with the mission of this healthcare facility, and that's making sure our patients get the best care possible from us. We educate them about the prevention of serious disease and make interventions to decrease the risk of contracting certain disease, and certainly COVID is an example of that. So my experience here at Western Wisconsin Health, being in this throes of this pandemic, where we're learning about this disease, just like everybody else is, we're going through the exact same thing, has been a very positive one and an exciting one. And 2021 is going to be that much more fruitful. Yes, we have the vaccine, but there's still a lot of information to glean. And this is where I think we continue to trust the science at this facility to continue to make the right choices in terms of vaccination, prevention, and treatment of acute disease.